Howdy everyone! You are listening to Blue Jeans and Boots, where genetics grad students talk about their research and navigate the PhD program while trying to stay sane. We also invite our faculties here from the interdisciplinary program here at Texas A&M University and pick their brains about their research, what's like to be a principal investigator, and their journey of becoming a professor here at A&M. In this episode, we'll be talking to Lilia Sanchez. Lily is a senior PhD student in our interdisciplinary program in genetics. She successfully defended her dissertation this fall, so congratulations. She is under Dr. Weston Porter's lab, where she studied the mitochondria and mammary gland development. My name is Khushboo, and I'll be the host for you today. Welcome, Lily, to the program.
Thanks.
How are you feeling today, Lily?
I'm nervous.
Nervous?
Yeah.
Why?
I don't know, man. It's weird being on this side.
Yeah. For our listeners, so just a little intro. Lily was one of the initial members when our podcast team started. So she was the initial member. So she helped us with being a host as well as the editor. So how is it like to be Lily on the other side and being interviewed now?
It's okay. When we started, I think we started during COVID or maybe right before. I was interviewing people like from my office and like just walking into the studio and like fancy TV and everything. It's
weird.
It's very different. But I also don't like being on this side or being a guest because like as a co-host or even as an editor, you have control over what's going to happen, and you have like a higher vantage point. You can see like everything that's going on versus like being a guest. You're kind of like, oh, what am I going to be at?
You do good. I believe you.
It's okay. I saw even though I saw the questions before, I'm like, is she going to change them up? If she changes them up, how do I react?
I will not randomly pick up any weird questions for you and just do a spotlight on you. No.
Okay. Yeah.
So you were with us for almost 2 years, right? In this podcast team?
Maybe. I think so.
So during that time, what are your best memories?
Best memories?
Or do you want to tell us your worst memories?
No, worst, no.
I hope you didn't had worst.
No. It was, I think like all the interviews that I did and all the times editing, the time that I spent editing it was all fun. I feel like I mostly hosted or co-hosted student interviews, which is interesting. Maybe I just was intimidated by PIs, but I had a lot of fun interviewing you and Adavin.
Yeah.
It was really funny because we would just kind of gang up on him a lot. So that was one of my favorite memories.
So she interviewed me and now I'm interviewing you.
I know.
Yeah,
How does it feel to be on that side?
That's why I asked. But it's different. Now I like to being the host and manage. So I like this role.
Yeah.
So being on that side, I know how weird it was for me when I was interviewed for the first time.
Now I know. I know. It's great. But yeah, I very much prefer being on behind the scenes, being back there.
Hidden.
Yeah. Or editing, because like even if you're co-hosting, you can like say something or have a conversation and there's a piece that you didn't like, well then I can just go back and edit it, which I sometimes did. Like, oh, we just cut this out. But like as a guest, you don't have that. You're just like, well,
no, we can still do that if you want us.
Okay, I'll be there.
So about your research, since you defended your PhD, so congratulations on that part. So would you like to tell us what was your research in your PhD?
Yeah. So you kind of said it in the beginning. I came in and basically studied or worked under one of Dr. Porter's senior grad students. So her work involved looking at like mitochondrial dynamics throughout mammary gland development. So I came in and sort of finished that work, but also sort of expanded. So this is very like cell biology heavy, but so she was looking at mitochondrial dynamics, mitochondrial health, and how that's involved in normal development. And I came in kind of on the back end of that and then expanded that more throughout the cell in the sense that mitochondria and mitochondrial behavior is very often influenced by how it interacts with other organelles within the cell. And so I was particularly interested in how it interacted with the endoplasmic reticulum. So if the mitochondria are famous for like ATP production and they're the powerhouse of the cell, the ER, or the endoplasmic reticulum, is like most well known for protein folding, but they interact for a lot of different processes. There's calcium regulation involved, cell death processes, just a lot of different like fundamental physiological cell processes that they communicate with each other in order for those things to kind of happen normally.
So
or proceed normally.
So just to follow up, so like you said, mitochondria is the powerhouse and it regulates everything and it's the energy house. So in that research, and since you work on the cancer, did you find anything interesting? Is it it's controlling cancer, or is there anything you can share with our audience?
Yeah, so there's kind of like two facets of Weston's lab is the people that work with cancer cell lines, breast cancer tissue. They even have meetings with advocates and survivors. And then there's the side of the lab where I'm involved in is if we can figure out how things happen during normal development, then that will hopefully give us insight into how the disruption of those processes then can lead to cancer progression or cancer development.
Okay.
Yeah. So a lot of my work involved using just normal mammary gland tissue, mouse mammary gland tissue, because our model is, we work with mouse models. Yeah. Or mouse cell lines. So I didn't directly work with cancer, but I'm hoping that I feel like this is the hope of every grad student, is like their research
to work
kind
on
of
something interesting.
Yeah, we're gonna address the gap in knowledge, and like the gap in knowledge is like this big.
You only answer one tiny part of that gap, and still the question is this big. Mm-hmm. I feel you.
Yeah. So that's. I hope that's where my impact in cancer will be.
Okay. So since you are working in cancer research, so I know breast cancer is a very big thing, but what are the challenges for you when you faced as a grad student while working on this research?
Yes, the challenges as far as working with or in breast cancer. What's the biggest problem with breast cancer?
Yeah.
Biggest problem. How much time do you have? Is that
you can give a little brief for our audience so that at least people who have just a small idea what's breast cancer and why it is a big thing and why it is worth studying. So something.
Oh, yeah. I mean, I think one of the reasons that it's worth studying is because it's still one of the biggest. Oh my gosh, how do I say?
So how much percentage of the females are affected with breast cancers? Like if you have any stats?
Yeah. So this is like semi off the top of my head, but about like 30%, I want to say about 30% of like diagnosed cancers in women in the US are breast cancer. So it's the most so it's the most common cancer that's diagnosed, and so it is still a public health issue and it's prevalent, so it is most definitely worth studying. The problem with either studying breast cancer or trying to diagnose or treat breast cancer, I mean, first of all, it's the heterogeneity of the disease.
Okay.
So rather, I don't want to say it's even one disease, but it's almost like multiple diseases in one. Even within one patient or a certain patient, you can have like multiple different subtypes of breast cancer.
Oh.
Yeah. So there's a heterogeneity of breast cancer that is an issue. Then you have to take into account the risk factors involved, lifestyle risk. There's so many risk factors, so many different types of treatments that are involved. And
can you also say like when it is identified, that also is one of the factors?
Yeah. When it's able to be diagnosed is a factor. And honestly, even if we were able to like solve all of these things, like honestly, our healthcare system isn't that great. So we have the treatments, maybe, like, let's just say we had the treatments hypothetically, and then it's getting it to the people that need it. So there's so many different levels. Yeah, involved.
So finding the exact question and then getting the answer and then the next question and finally getting to the result. So it's a long step.
Yeah. Bunch of long steps. Yeah.
So I know that before you joined your doctoral program here, after your undergrad, you worked as a teacher, right? And then you did your master's. So do you like to tell us what was your prior research before coming to A&M?
Yeah. So my master's research was actually also in cancer.
Okay.
So it involved so Weston and our lab have like our molecule of interest called SIM2.
Okay.
And then my previous mentor had another transcription factor. It was FOXO. I'm not sure if it's something different now.
Okay.
But so studying sort of like novel pathways and novel targets for that transcription factor in cancers such as glioblastoma and also breast cancer. So I kind of come from
cancer research.
Yeah.
So it was something during this time which inspired you to continue this kind of research or even enter the grad school?
Yeah, because while I was doing my master's, I saw that there were other people applying for PhD programs, and it wasn't something that I'd considered before. Because like growing up, I always liked science, and I always kind of had this sense of curiosity, which like pissed off my parents because I was always like, but why? And so like I always had questions. So they're like, always annoyed with me. But I had that sense of learning, that sense of curiosity. And my mom's a nurse.
Okay.
So she's a home health nurse. And sometimes there's a babysitter, sometimes there's not a babysitter. So sometimes I would like travel with my mom and go to like the different appointments. So I knew I wanted to learn or to do something with my life where it had an impact on people as far as like their health.
Okay.
And so I knew that was sort of the route, I guess, that I wanted to go, but I thought I was going to be a doctor. I think like everybody that kind of grows up in my background, we think, oh yeah, an MD, a doctor.
It's usually like this way. To have an impact, the first thing we get to know is to be a doctor. But then there are different ways to have an impact.
Mm-hmm. And I didn't know that until after I finished undergrad. And once I started teaching, I thought, oh, I can go back and get my master's. And then once I was in my master's, like in that environment, I found out, I can get a PhD and I can have an impact that way. It's a different form of impact.
No, that's still an impact because you are working for the welfare and creating an impact on the humans rather than treating it. So
it's different. Yeah.
So what made you decide to work on cancer and nothing else? Because there are different fields again.
Yeah, there is.
Or it's just like you applied to the school and you joined a lab?
Yeah, so far I've ended up working on cancer kind of on accident because I kind of tell this to students too. I go for the mentor, and I mean, of course, the science is important, but I try to look for the mentor and their leadership style and mentorship style first, and then I can get behind whatever science they're doing. And
that's actually a very vital thing to have a good mentor because they can improve your skills and sharpen you in a very good way.
Yeah, or the opposite can happen. So
that's true.
Yeah. But yeah, so that's happened so far at the different levels. My undergrad mentor, I believe, studied cancer as well. My master's mentor, and now Weston, his research is cancer, breast cancer. He's kind of venturing into other fields, but generally, that's the main point. Mm-hmm.
So your teaching and your entire childhood, everything made you come to the cancer research. But then why did you select the gene program in A&M and specific? Why Porter Lab? I understand because it was cancer research. Or are there other labs which also work on cancer and you selected Porter's lab for some reason? Mm-hmm. And why gene program?
Why the gene program? I think I applied for a long time. I wanted to kind of and I'm not saying this is not the case anymore, but I wanted to get out and explore and just see something else outside of where I grew up because I was born and raised in Rio Grande Valley. And so I wanted to get as far away as possible. And
But
so,
you far away is still Texas.
yeah. And then I ended up here. I applied to everywhere, like kind of across the West Coast and Northwest.
Okay.
And I did get to interview with schools there. But I don't know. I think my priorities shifted, and I realized I do want to study and earn a PhD, but my family is really important to me, and they're still in South Texas, and I need them in the sense that I need community in order to flourish, and I don't think I can be that far away from them anymore.
But Texas is a big state, so you are still far away.
I mean, far enough away.
Far enough away.
No, but I do still get to see them, drive down when I can. Oh, sorry, I didn't mean to make that noise. I do still get to see them, and so I think that was a big reason where my circumstances and my family for me choosing Texas A&M. But it's location. But I mean, when I was being recruited and meeting with professors and the students here, it's just a different sort of feeling, maybe that Southern hospitality, very Texas.
I will admire Texas has this hospitality, which I don't see it in other states. I'm sorry.
It's
no
different.
offense to others, but
Yeah.
Southern state has its hospitality.
Yeah. And it's just a different feeling. And maybe it was a feeling also that I'm used to.
Yeah.
And so I thought I will be able to be successful in my PhD if I have these sort of people around me.
So, and why Porter Lab then?
Oh yeah, so when I was rotating in Weston's lab, his mentorship style is very similar to my master's, Dr. Kennery. They are both involved in, like, they come down in the lab, they're involved in your projects. They're different. They are different. But I knew when I was coming to A&M that I wanted a mentor that was similar to her, because I had a good experience with her. So he, from the rotations that I did, I liked his mentorship style. And
So you decided to join.
yeah. And it was kind of an accident that he was working in breast cancer as well. I don't know if he remembers this, but I remember, and this was probably one of the biggest reasons that I joined, is when I was interviewing with other professors, and this was true for other programs as well, a lot of times professors love talking about their research.
Yeah.
And it happens because you
Yeah.
get excited about your science.
Of course.
But it was funny with him when I was talking with him and I told him about my research. He was excited about his research too, but he kind of like offered insight into my project that I was doing then.
Okay.
Yeah, which was, I was like, oh, okay. He listened to me. He has advice. He has suggestions. I'm going to keep this person in mind if I do get to join this program. And he ended up needing students.
And you ended up joining A&M and Dr. Porter's lab.
Yeah. Yeah, I don't think he remembers, but I remember. I was like,
That's
I'm gonna
good.
keep this person
So
in
if he
mind.
listens, he will remember this now.
Yeah.
So while you were starting your journey, I believe you would have role models also. Some people would have inspired you to be where you are.
Uh-huh.
Do you have role models? And who are they?
Yeah. You're my role. No, I'm kidding. I mean, yes. I want to say that
Thank you.
the people around me, and this is true like at all levels. Even like, I just remember when my grandma would take care of us when I was little, but there were older kiddos from around the neighborhood that she would also take care of. And even at that level, like my older like neighborhood friend, I don't know if we were friends because she was older.
Yeah.
So like there's the age difference. But she would like teach me how to read, teach me how to do math.
The community.
Yeah. So at every level, I think I've had mentors that have just kind of pushed me. So my parents, my family have inspired me, even though they are not scientists per se, but in just the work that they do, like the work ethics that they have. My teachers, my science teachers.
Parents, even though they're education is not what we do. I believe they are our role models for giving us the basic personality and what we are and what things to do and not to follow. Have good habits, actually.
Yeah, good habit, how to problem solve,
Yeah,
critical thinking, just the basic skills that you use later.
that's true.
Yeah, but my science teachers too, like I could tell that they liked what they taught. And then at the university level, my professors, they were the ones, especially in my master's, the university where I got my master's from, they were the ones that were like, apply, you can do it, and apply it to this and this type of program, and be prepared because this and this and this is going to happen. So yeah.
So you're basically, you have everyone in your life. That's actually very true, to have everyone in your life as your role model, because everyone teaches us something or the other in our life.
Yeah. I'm sorry I don't have a specific person, but
That's okay. If you ask me, I don't think so. I will also have a specific person.
Okay.
So you're
It's
good.
been the community behind me.
It's everyone.
This is everyone's degree.
Yeah. So you're thankful to everyone, actually.
Everybody. Everybody's going to wear the cap and gown all together.
That'll be nice, you know?
Yeah. But yeah.
So something very different note now. So I know all grad students or the doctoral students, they have a very busy life managing their academic requirements and their personal lives. So do you have any advice for the incoming students or the current students, how to manage everything and still stay on top of everything?
I don't know if I did that well enough to be able to give advice.
But have defended and you are graduating, so you have done it.
Something right.
You did something right.
Yeah. What would I do?
Let me ask it the different way.
Yeah.
Looking back, if your first year when you joined the PhD program, if there is anything you would have an advice or you would have done differently, or something you struggled and which could help our listeners or the new students not to do those mistakes. Like, we also learn from our mistakes, but knowing our mistakes is a big thing which we learn and overcome eventually. So advice in that way also would work.
Yeah. So in my first year, what I would change was I was so scared to do something that I just wouldn't. But I think now, as a senior grad student or as a postdoc, wow.
Yeah, she is joining
As
a
a
postdoc.
I'm
now.
joining. Yeah,
That's my follow-up question. I will not change the topic now.
Sorry. Yeah. Now as a postdoc, I just kind of
you
wait and
used to.
see. Yeah. Now I would say, talk to your PI, right? Talk to your students and mentors around you, but you are going to make mistakes. You're going to have to get comfortable with failure because it's going to happen. There's been so many times that I have followed a protocol
Step by step,
the way it is. And I don't know, the moon phase was just not, and the science gods were like, no. And so it's going to
happen.
Yeah. So I think one of the biggest things I would tell myself is get comfortable with failure.
Exactly.
Especially in our field, I think.
That's actually very true. To accept you will have failures, and that doesn't mean that you have to stop working.
Yeah. Don't stop working, because then I think that's when you actually fail.
Exactly.
But it also helps me, it has helped me that there are other students in the lab, and I just come up to them this is messed up, and if they can't help me, they can at least be sad with me.
That's true.
So that
joining you in your sadness and giving you
yeah. So I think that's what advice I would give to them. I would also try to find something to do outside of the lab. You can exercise. You can go be involved in church. You can be involved in some other club, because that helps you kind of take your mind away from the
lab.
Yeah, and you get to
meet other people, have a distraction from whatever failure or the stress you are dealing with.
Yeah, and come up with new energy.
New energy. That's true, actually.
Yeah. It helps. That helped. That helped a lot.
That helped a lot.
walking a lot during COVID years when you couldn't meet with people. I would at least walk a lot. So anything that gets Pokemon Go. Anything that gets you moving.
I should install that and play. So basically, reach out to people when you have failure and accept the failures and try to do something other than your own research.
Yeah, I would say that helped me a lot.
So when you say it has helped you a lot, so do you like to tell how you have grown professionally and personally from seeing yourself in your first year versus now since you are graduating this December?
Yeah.
Actually, this month only, in few days.
I know, in a few days. I think this is something that a lot of people struggle with, but even if it has improved just a little bit, my confidence as a scientist, I think, and my confidence in myself as a student or as a professional, that I think has increased a little bit. I think a lot of grad students can tell you that this shift happens in the beginning when you first join the lab. You kind of just do everything that your PI tells you to do. And with somebody like Weston, he has like 5 or 7 different ideas, and you're like, which one do I do? I can't do all of these. Sorry. But as you,
then you eventually grow up.
As you grow professionally as a student, you start to kind of realize this one and this one are doable and feasible. So I'm just not going. Yeah. So your confidence as a scientist improves. And I think mine has.
Yeah. So I know her since Lily is the same cohort I joined, so she has improved. Like, we have improved way too much and become confident, and we are ready to face the challenges since we have accepted to learn and grow up with our failures, like your advice. So you have made a remarkable improvement. So I'm very glad to be your friend.
Oh, thanks. I think we've both improved.
Yeah, I think too. So I will give you the toughest and the most challenging question everyone asks. What's your next step after you graduate? Sorry for the whole drama, but this is the toughest question, and I hate that question. But
I know.
That's why toughest and most challenging question for today.
It's like, what's in the future?
What's in the future?
When I joined, I was like dead set on being a professor and becoming a PI.
Okay.
That has changed. I have changed, my priorities have changed, my preferences have changed. So I'm looking for alternative career paths. Industry, maybe I could still be involved in the academic setting, but involved in like a core or something like that. So I'm open.
Okay.
Especially for a postdoc position. So my goal is to find an alternative path to being a PI. Things have changed.
Things have changed. Yeah. It's more struggling to be a PI and get the grants now.
It is a struggle.
It's a struggle. So
it's stressful.
Yeah. I feel your pain in that part.
Yeah, but it's interesting how even that has changed.
You have also taught before you started your master's. So is teaching one of the list, one of the things you like to pursue, or it depends? Or as the life comes, you would look at it?
Yeah. I think, like you said, as life comes, then I'll kind of take it and like assess, see what my best options are, and then kind of go for that, which is kind of how I've been living life so far.
I think that's the best way to live. Yeah. Like, what comes, you just accept it, because the priority keeps changing every year or every other time. So
and so far I've been okay. I mean, I'm honestly thankful for like my family, my friends, people around me. I've been okay.
Now you're joining as a postdoc, right?
Yes. Immediately right now, I'm joining Weston's lab as a postdoc.
So the moment she graduates, walks, she's joining as a postdoc.
Hooray.
Yeah. So she has a job now.
Yes. Thankfully, I do have a job.
No more student life.
No, it's such a weird transition. Especially like I still want to go to meetings, but like I'm not a student.
You can still come to GGSA and podcast meetings if you want.
Oh, okay. Just
I think we'll be very happy to have you.
Oh, thanks.
We won't consider you as a postdoc that time.
We'll see.
You'll see.
But yeah, it's a weird period of transition.
I know you will do good in this transition period.
Thanks. Yeah.
I have a very strong confidence at you. I'm rooting for you.
I'm
you will
glad
do good.
Somebody does. No, I'm kidding.
I know there'll be a lot of people who will be rooting for you.
Yeah, thank you. It's been an interesting journey. There's been like
the interesting journey coming to an end for you. At least for doctoral.
Yeah, for now.
So we can officially call you Dr. Lily. Or do you want to be called as Dr. Sanchez?
No, however you feel more comfortable. Whatever you want.
What's your preference? I go with the preference for the people.
Oh my gosh.
You should decide, because once you become a postdoc, people would address you as Dr. What?
People call it, like, I've gotten emails already that say Dr. Sanchez, and it's like,
You get the goosebumps.
Yeah, I don't know how I feel about this. Dr. Lily's fun.
Dr. Lily's fun?
Yeah.
Okay. So Dr. Lily it is.
Yes.
So Dr. Lily, I will call you now this.
Okay.
Since we are towards the end, so do you have any advice or suggestions for overall to our listeners and the students, how they should apply and how to approach anyone? And any advice or suggestions you would like to tell?
For our listeners, are they like,
the listeners could be incoming graduate students, current grad students.
Yeah.
Or anyone who is still in their undergrad or masters and not very sure if the grad program is for them, like the PhD program is for them. Any advice overall?
I'll say this in the context, like, this is what has helped me a lot. And I have, I think, repeated this multiple times in the in this session. What I would say to either incoming undergrads, or maybe if you are an undergrad and or a master's student and debating on whether a PhD is for you. And again, this is what has worked for me. Kind of evaluate yourself, where you are in life, and talk to people around you. Talk to your friends and talk to your family, and they will support you. Like, they want what's best for you. And so share your dreams. I think share your journey with the people around you is what has helped me the most. I don't know. I think we are kind of often taught to be self-sufficient. This is something that I struggle with a lot too. But you can't do this journey of life. You can't do this journey alone. So I think the biggest advice would be to bring others along with you on that journey. And so, yeah, because they'll help you decide where to go, which program. Your professors, PIs will tell you, don't go there. Or they'll tell you, oh yeah, go there. So yeah, talk to the people around you. Is that what I think I would tell undergrads or masters, or if you're listening and you're a high school student? That's what I would say.
That's a good advice. Ask everyone, even if nobody in your family knows. Ask others if you are interested and you are a person who has more wise like you. Yeah, that's actually why even most of us, we join the doctoral program, since we have the curiosity and the thrill to know the answers. So if you are one of those, ask around, add more people in your life who can help you.
Yeah, who can help you. Because you're not going to take everything that everybody says and do it. Because people are going to have conflicting things.
Of course.
So,
and you need to find something what suits you.
Yeah.
That's a good piece of advice.
Thanks. You're so nice.
No, but that's really nice. And it was our pleasure to have you, Lily, as we are concluding. So thank you for coming. And
thanks for having me.
It was a pleasure to host you. And thank you again. So today's episode was hosted by me, that is Khushboo Rastogi, and produced by Aaron De Silva. This episode is brought to you by Texas A&M University Interdisciplinary Graduate Program in Genetics and Genomics. If you have any questions for our program here at A&M, please feel free to email us at geneticspodcast@gmail.com. You can also find us on Facebook, Instagram, Twitter, as well as on TikTok at Genetics Podcast. And in the end, thank you for listening, and we hope that you will tune in for the next time. Thank you.